Okay. Okay, I've got the notification that we are recording. Dr. Cullen, can you hear us?
Yeah, can you guys hear me?
Okay, well, thank you, Dr. Cullen. Yeah, I think we're good. Dr. Cullen, the floor is yours.
Great. Well, thanks everybody for joining us. I just want to spend a few minutes doing some overview, and then we will spend the majority of the time taking questions so we can make sure we can provide you with answers to that. I want to start initially with our dashboard. You may be aware our dashboard moved in the last 24 hours, which is so exciting. We had been predominantly red for about an 8 to 9 week period. What moved was our hospital availability, though at the same time that moved to yellow. We also do note that today is the 100th day when we have had less than 10% availability in our ICU beds, as well as our general medical surgical beds. Those are our adult beds. So at the same time, while we have some movement in the right direction, we remain concerned about our hospitalization. The other thing that moved, though, I think is really critical is our public health case investigation, how quickly we're able to do that. This is a real tribute to the community, as well as some software that we put in place to try to help us make sure we had the right address and information about people that were cases. But this does mean that we are able to successfully contact an increased number of people within that critical time, which we've talked about, that epi curve of a day after you test, a day after we get your result and we contact you, and then a day for when we contact your contact. So this is an important increase in our ability to respond to the pandemic, which does continue. I want to just talk briefly about the vaccine. There was some information that came out, I'm sure you saw, from the memo that Mr. Huckleberry has shared with the Board of Supervisors. But from our perspective, there's a few important things. What I would remind you is those numbers, even in that memo, keep changing. Remember, they're dynamic, they're not static, because we continue to give vaccines in arms throughout almost every day. So right now, when we look at our amount of delivery of vaccine, we are between 91 and 95%. That means vaccine that has come into the county has been effectively utilized and administered. Those are great numbers. They're about where we would love to be on a regular basis. In addition, when we break down our percentage of people over 70 and over who have been vaccinated, we end up at a rate of between 44 and 46%. There's some fluctuation in what is that true denominator. But once again, that's where we want to be. We're really vaccinating that population that is so critical to us because of the morbidity and mortality we've seen in that patient population. So we continue to move ahead with our vaccination schedule and make sure that we can address the truly vulnerable and our disadvantaged. And I'm sure you'll have questions about that. I do want to talk about our genomic analysis. This has come up in the past. We have now entered into an agreement that has been developed by the state with TGen. You've heard us talk about them before. Right now, we are in the process of delivering 50 to 75 samples a week from our Paradigm lab. These are samples that have tested positive, and we want to run a genomic variation on them. In addition, we are helping the state collect samples from other laboratories in the county to make sure that we can have early eyes on any variants. I will tell you that as of now, we have not had any variation reported to us. TGen did just get a large sample this week, and we'll let you know as soon as we hear anything about that. And finally, I want to just mention the schools. As you know, CDC had a big call this afternoon at noon. I actually was not on at 2 o'clock Eastern, but I have gotten reports on it. The good thing, I think, for our community is we are on target with what CDC is recommending. You know, they're recommending the inclusion of masks, the inclusion of the 3 W's, wear, wash, wait, cohorting, and then finally testing when it is appropriate. And we have been working with our school districts to make sure that they're all aware of those recommendations. So good news, nothing struck us as inconsistent with what we have been doing in terms of our schools as we move forward. And the other good news is we're right there to support our schools and make sure that we can provide them whatever their decision is in terms of what kind of learning style they want to do. And with that, I will turn it over to questions. And Jason.
All right. Thank you, Doctor. First up today is Patty Mackler, followed by Alex DeVoid.
Hi, Dr. Cullen. Thanks for your time this afternoon. So my question pertains to the cuts to first doses announced today and Chuck Huckleberry's memo to the board. And I wondered, the new plan that's going to come out, when can we expect it, and what should people expect to see in this new plan?
The new plan, hey, thanks, Patty, for that question. I just want to make sure I understand the new plan. So there's a tiered system that we have embraced that is part of his memo. And let me just briefly go through that really quickly, at least the first part of it, because it'll be things that are familiar to you. The first tier is what we call our orphan ALFs, our orphan assisted living facilities. They're obviously not orphans. They're the assisted living facilities that were not engaged in the federal system of Walgreens and CVS to ensure they had vaccination. We've already begun on that. We thought we had over 150. We've narrowed it down to 100 through lots of contact with the community. About 25 of those facilities have already received vaccination on site through our public health nurses and other organizations that are helping us. Our goal is to continue to make that a priority. I'll recall for you, those are part of 1A, which is why this is such a priority. Remember, because it's congregate living, assisted living, high risk morbidity and mortality. The second approach to this is really this vulnerable and disadvantaged population, and that is a secondary report that is included in the memo that Chuck sent out today. We've been working on that for about the past month with the recognition that while shots in arms is what matters, what really matters at the end of this is that we make sure we try to address and improve the inequities that have historically existed, not only in our communities, but throughout the nation. So that attention to that disadvantaged population takes many different forms. Many of them are outlined in that that report. But the one thing I want to call out is the mobile clinics. So we did have a highly successful mobile clinic about 10 days ago. We have another one that we planned for this weekend that we were unable to do because we didn't have enough vaccination. So we pulled back on that. What we do envision is making another clinic schedule for a week from this Saturday, which is the 20th, and continuing to work with this population to make sure we get vaccine delivered at the point of care. This population, people that fit in this population seem to not be represented well in our large pods, and we want to make sure we get to them. The next is the second shots. We have preserved second shots. We believe, especially if you look at who got the first shots where we are, remember this is primarily a population that is 70 and over right now. We believe it would be incredibly disruptive to this population to cancel appointments and then to have to reschedule and to find another time to reschedule. So we've protected that population as we move forward with our vaccine distribution for this week. The next one is obviously first new shots. That's where you're seeing the impact on any kind of constraint with the vaccine supply. We are opening up less new what we call first appointments within the county-run facility, the county-run pods, based on the constraints that we're seeing coming in from the state related to vaccine availability. Hopefully that answered your question. Thanks, Patty.
All right, up next is Alex DeVoid, and then Bud Foster.
Hi, Dr. Cullen. I talked to another source this week, and who said that the county's goal for vaccinations is to have 65% of the population vaccinated by the end of June. And I'm wondering if that's still the goal, and how has vaccination supply affected meeting that goal, if you think it will still be met?
So that's a great question. We actually had two goals. One was called our minimum acceleration plan, and that is where that 65% came in. On our maximum immunization plan, we were hopeful that we would get almost everyone immunized in the county by the end of June. That does include our belief that a certain number of people will opt out, and we've targeted that at 20%. That's based on national data. It's not based on a survey that's been done in the US. And once again, because the vaccines have not been authorized for people either under 16 or 18, depending upon which one, we've taken that population out. As we slow down immunization delivery, obviously we affect those goals. However, I do think we are looking forward to hopefully within 3, 4, 5 weeks to have accelerated delivery of immunization. Remember, the Johnson & Johnson vaccine goes before the FDA at the end of this month. Our understanding is that there's 100 million doses on the shelf. Remember, that's only one dose. Our initial immunization plan was calculated based on the need for 2 doses for everyone. So despite the fact that right now we have what one could describe as a constrained environment for our immunizations, and we do have an impact in terms of what we've been able to do because of that. We do look forward to and anticipate having an acceleration after that. The other thing I would say is, you may recall when we first started this, we talked about this, what we thought was an audacious goal of 300,000 doses by the end of March. We're at about 180,000 right now. So if our vaccine supply can increase and go back to where we were. At one point, we were almost getting 30,000 shots a week. And I think that a graph on that is also included in Mr. Huckleberry's memo. We should be able to stay on target. This week, as you know, we got 16,300 shots. Seems like a big difference between that and 30,000, but obviously one that is doable dependent upon supply. Thanks.
All right. Next up is Bud Foster, followed by Christopher Conover.
Hi, Dr. Cullen. Thank you very much for taking the time to chat with us today. Several of us just got off a call with Dr. Kara Chris at the state. They did a full hour, and they were very complimentary of Pima County for its 95% utilized vaccines. And they said, you guys are doing a great job, but it also puts you close to the margins if you're 95% effective. And I think we're seeing that now. But we were asking, and Patty asked how many doses we were getting. And the state said, I guess the report was 16,330 is what Pima County will be getting for next week. And the state said, no, there's another 1,500 doses, Pfizer doses, and another 2,000 doses that they held back that Pima County will be getting. Can you explain how many doses we are getting next week based upon all of this stuff that we were given by the state?
Yeah, so Bud, thanks for that question, because it was even confusing to us yesterday, but we sorted it out. So we have a software tool. You can think of it like an Excel database that opens up, literally opens up all of a sudden, it's like magic. It opens and you can see what your allotment is from the state. And then we are given a period of time to discern and distribute that allotment to our pods and our other providers that are onboarded. That allotment tool gave us 16,300 Moderna yesterday. We allotted those 16,300 Moderna by 5 o'clock yesterday, and the people that are receiving them know they're receiving them. We then had an ongoing dialogue with the state because yesterday we got no Pfizer in our allotment. And we have facilities, as you know, rely on Pfizer. So we had multiple, as you can imagine, discussions with the state yesterday. The state is allotting the Pfizer. We don't have control over it, but they did allow us to give them some direction about the Pfizer. So we did ask them to allot Pfizer to both Banner North and TMC. We actually don't have insight into what that allotment was. They did indicate that they were taking high consideration of what we had recommended those allotments are. So I surmise that they did allot that Pfizer to those 2 facilities, but I don't I can't verify that, but I have no reason to believe that that isn't accurate. At the same time, and you may have read similar blogs to what I read. I read Dr. Chris' blog yesterday where she indicated that they had taken 2,000 of our Moderna and allotted that to the university. Now, we don't have insight right now into what the university got allotted. So I think overall what you're hearing is there's 3 different ways vaccine is allotted now. There's vaccine allotment to the county, where we coordinate with all our pods as well as our other onboarders. We work with them closely. We follow the numbers. We know what's going on. That's Moderna. Our understanding is from this point forward, Pfizer will be distributed by the state. We have asked the state to make sure we're in that middle somewhere because of our facilities that are using both Moderna and Pfizer. We want to make sure that they're covered, and you really need insight into both of them. You can think of it as a patchwork quilt of 2 different patches that are really important. And then finally, there's the University of Arizona allotment that we don't have insight into right now. Hopefully that helps explain it.
All right.
So how many doses are we getting?
Well, I know we got the 16,300. I don't have confirmation of the Pfizer yet, though I assume that we will get that indication sometime, I would hope today, and we don't know what the university is getting. So you're right to ask this question. What is the county getting? I can't answer that right now for you, Bud.
All right. Thank you, Bud. From Bud to Buzz Conover, followed by Iram Rascon.
I guess kind of to follow up on Bud's question and some comments that were made earlier in the week by Dr. Christ, by Dr. Robbins, and then we talked to the governor about it also with this new UA site. So this week we know, in theory, we're getting 16,300 doses plus whatever the Pfizer is that we're still waiting for the final count on. We don't know what the university is getting. The 16,000 plus the Pfizer is about what we got last week before we took the 12,000 cut. So is the university cutting in? Are they taking that from Pima County, or are they taking that from the state? It still seems not exactly clear who's responsible for the university's share.
Chris, it's a great question. So I can answer it based on what I know. What I do know is that it was, Dr. Chris did say in her blog that 2,000 Moderna was, the way I interpreted what was there, is that 2,000 Moderna that would have come to Pima County Health Department for allocation instead was allocated directly to the University of Arizona, with the belief that the University of Arizona serves county residents, right? So if you add that up, you get to 18.3. We didn't have that insight, but we do now. So we understand that it coming into the county, starting next week, will be this 18,300 doses of Moderna. The amount of Pfizer coming into the community is unclear to me, but we know there will be Pfizer because there has to be Pfizer. We need Pfizer for our second doses, both at TMC and Banner North, and the University of Arizona has been running Pfizer. So the ideal situation would be, while we're constrained in the amount of Moderna coming to us, that overall, because of an offset with Pfizer to TMC and Banner North, and then one hopes for additional vaccine that's coming into the University of Arizona, that overall the county is at a higher dose, but I don't know that number right now.
All right. Thank you, Christopher. Up next is Iram Rascon was there, but I guess he's dropped out.
Oh, sorry,
okay,
I'm here.
Go ahead, Iram.
Perfect. Thank you very much, Doctor, for the press conference. My question would be, if you don't know the number of vaccines, and you already the state already announced the initiative of the pod in the University of Arizona. This will be a problem for the people in the sense that people expect to that be much faster and more vaccines available. I mean, that's not confusing for the people.
Yeah, Aram, it's a great question. We would hope that we can mitigate and minimize that confusion, but we do share that concern. So what are we doing to make sure people don't end up in that situation? We are continuing our other pods. So Banner North, Banner South, TMC, Tucson Convention Center. We're continuing our work with our federally qualified health centers and our other organizations that we have historically given vaccine to. We are working closely to ensure that our call centers, because this is where I think the confusion may happen, right? And I was asked this before, if I'm an individual and I want to get a vaccine, where do I go? So I can go to Banner, I can go through the public health department, now I can go to the state pod registration. So it behooves us and is a shared responsibility for all of us to make sure that we have information available for individuals. Now, individuals have choice. They could decide to go to any of those sites. They could go, they've historically been able to go to Banner or come through Pima County Health Department. Now they have this other choice, which is the University of Arizona State Pod, which will use a state registration system. So our hope is that, and it seems confusing to me just when I even say all this, but our hope is that we'll be able, and we're in the process of doing this, of pulling information together enough so that the residents of the county will be able to understand this. In addition, you'll recall, this is a state pod. So it's not just limited to residents of Pima County, right? I envision that the state believes that part of this will also serve other counties and the southern part of the state. We see that with the Maricopa pod. Actually, we talked to the state just today to get a sense of how many out-of-county residents have gotten vaccines at Maricopa at the state pods, because, to go back to the question, and I can't remember who asked it, about our acceleration plan, even if we get more vaccine into the county, if we see other counties' residents come here to a large extent, it will impact our ability to predict the appropriate vaccination for the county. Obviously, the vaccine knows no geographic boundaries. We want everybody to be protected. When we talked to the state, they told us about 6% of their people that had received vaccine at one of the state Maricopa pods are from out of county. We actually don't know what we're going to see in Tucson for that.
Thanks. All right, thank you. Next up is Taja Davis, followed by Eric Fink.
Hi there, Dr. Cullen. So can you talk more about the county's consolidation plan with the vaccine supply that was mentioned in the county's memo?
Yeah, thanks, Tasha. So what that consolidation plan means that we will pay attention to the tiers, which I talked about, the I hate calling them that, the assisted livings, the vulnerable populations, and our second vaccine. In any kind of consolidation, what you are going to see is, assuming that there's vaccine constraint, right? If there's not vaccine constraint, the discussion will be totally different. But during a period of vaccine constraint, what you will see is less first dosing. And you saw that part of the memo does talk about Tucson Convention Center cutting back their hours. It's only an hour a day. It is 5 hours a week that they're cutting back. And some of that is because there's less vaccine coming in, especially there compared to the amount of vaccinations they are able to deliver. So the impact is less first appointments for vaccine.
Okay, thank you, Taja. Next up, Eric Fink, followed by Sylvia Sanchez.
Hey, Dr. Cullen, how are you?
I'm good. Hi, Eric.
Hi. So according to the state's new vaccine data dashboard, I'm working on a story today about some racial and ethnic disparities on who's getting the vaccine versus who's not. Now, we know a whole lot of people are not choosing to check the race and ethnicity box because it's not mandatory, but we also know that fewer than 10% of Latinos have gotten the first dose of vaccination and fewer than 2% of African Americans. How concerning is that to you, given the large Hispanic population we have here? And do you believe that the state-run pod that's opening next week at the U of A is going to create another hurdle into this?
Oh, this is, as you know, Eric, near and dear to my heart because of my commitment to equity and justice and our health department commitment. And I would actually say our board's commitment to that. I am very concerned about the statistics that we're seeing. We do worry about the 40% that we don't have information to. When you compare Pima to the other counties based on the state dashboard, especially to Maricopa, you see that we're doing better, but we should not, as I used to say about our testing, we should not be satisfied with where we are. However, we did, Mr. Huckleberry did include some early data from the very first mobile clinic that we did. We targeted a community based on some factors related to social vulnerability, case indices, mortality due to COVID. And we very successfully, in a sense, swung the pendulum at that clinic. What we saw is the population that we know we are most concerned about. An at-risk population. In that case, it was an elderly population because we're still vaccinating 70 and over. So the good news is I know we can change this. The concerning news is that I know that our large pods, the state pods, even our large pods can contribute to that inequity. And so it behooves us and really requires us to figure out how to ensure that we are getting vaccine at the point of care to the population that is most at risk. Now, we've talked about this before. Some of this is related to the time that pods are open. Some of it's related to the fact that it's a drive-through. There's not a bus. You can't take Suntran and go through one of the pods. So we, in a sense, automatically have created difficulties for certain subpopulations that we know are most at risk for morbidity and mortality. So when you look at our tiered system, it's why tier 2 is there, to basically say, we think that this is, we have to do our assisted livings, but we will get through them. Once we are through them, this much larger population who is at disadvantage needs to be paid attention to. To go back to your question, yeah, I worry about any large pod contributing to inequity as opposed to ameliorating it.
All right. Thank you, Eric. Up next is Sylvia Sanchez, followed by Austin Walker. Sylvia, I believe you're muted. Okay, why don't we go to Austin while Sylvia works out her issues, and then we'll come back to her.
Hi, Dr. Cullen. How are you doing today?
Good. Hi, Austin.
Hi. My question is, I know President Biden just released a statement that says all Americans can be vaccinated by July. In your perspective, is this realistic? And then if so, where does Pima County kind of rely on this, and what do we need to be doing?
Yeah, I didn't know that President Biden had said that, but I do think that's realistic. And the reason why I can say that with confidence is because we've done the numbers. We did it 8 weeks ago. We were ahead of most counties in the United States that said, what do we need to do to get there? Now, the caveat to all this, so the caveat is not infrastructure. In terms of Pima County, in other counties, they have different issues, so I can't speak about them. But for us, it's vaccine access. If there's significant delay in terms of vaccine access for the county, we will not reach that. If there, for some reason, are other issues around vaccines, it would definitely affect it. But I want to take this opportunity, Austin, to talk again about shots in arms. So it's not, because I worry, it's critical. Getting community immunity is critical, and we will get that by getting shots in arms. But we can't do that at the expense of leaving our rural neighbors, our disadvantaged populations, our other individuals that will struggle or have struggled to get vaccines to the table, to the door, or us in the door to make sure that they get vaccinated. So I think it's reasonable. I think it's doable. I think Pima County is poised to be at the table and to be a partner and actually a leader in doing that. But there's a few underlying requirements that will need to be met for us to be successful.
All right, thank you, Eric. Austin. Sylvia Sanchez, are you with us? Okay, in that case, we'll go to Hannah Tida, please.
Hi, Dr. Collin. I just wanted to double check on, are we still at that about 15% of Pima County's population being vaccinated? And I also just wanted to touch on overall immunity. I was reading in the New York Times that a researcher or an epidemiologist out of Michigan was estimating about 43% of Americans have some level of immunity, either being vaccinated or having had COVID. Where are we at, I guess, locally when it comes to immunity?
So let me answer it first. Thanks for the question. Let me answer that first question, because we actually did some math today. I call it the higher math. It's not higher math, but it seems higher math to me. So the percent of population, this was based on data from yesterday. Remember, it changes every day. The percent of population that has had some vaccination is 16.2%. So you're right on that. The percent of population that we believe is fully immunized, and this is the population eligible to be immunized, no children, but not taking away any people that may refuse the vaccine, is about 3.9%. We're actually developing a dashboard around these metrics based on some guidance that we've seen from the state of Minnesota, as well as a group called Resolve to Save Lives. So we hope to be able to get that data out there. These would be in the equivalent of run charts where we would be following them. So we're seeing that. And your last question, would you repeat that, please?
Oh, absolutely, yes. So an epidemiologist quoted in the New York Times is estimating about 43% of all Americans have some level of immunity, either having been vaccinated with their first or second dose or having had the coronavirus. Where do you estimate that we're at here locally as far as just immunity?
Yeah, you know, this is a great question, and I don't know the answer. So I believe that 2 weeks after you get your second shot, you probably are fairly immune. You got good immunity. I believe that if you had the virus in the last 90 days, and this is the complicated part of this, and you had what we would call a viral load that induced immunogenicity, that you probably have some immunity. We don't know what that second number is. So we know the number of people that have been diagnosed with COVID over the course, and we know we can calculate the number for the last 90 days. But I don't know from that we can speculate to get this 45%. And my worry about that is we don't know the longevity of the immunity we have. It's actually why still today, if you've gotten both shots and you're 14 days out, we recommend you still wear a mask. So I would be hard pressed to comment on that right now. I think that data will become clearer, but right now we really need to follow people out for a period of time. You know, the CDC recommendation is if you're 90 days post having been diagnosed, you should definitely get the vaccine. You know, they recommend if you've had the disease that you get the vaccine, but you do have this window where you can wait. That's based on the belief that we have immunogenicity for that 90 days. Thanks.
All All right, we have about 10 minutes left in our time. We are down to our second round of questions, and we will go to Patty Mackler for the first one of those.
Hello again, Dr. Cullen. So I'm still focused on cutting first doses, and I'd like to get an idea from you what this means, from a public health perspective, and are we going to be severely cutting first doses right now until we get more vaccine, or what's the outlook?
Patty, let me do this by a number then, okay, because it might be easier. We believe that our allotment that we got this week, this 16,300, remember, we are on razor thin edges right now, which it sounds like Dr. Christ alluded to with the amount of vaccine we've been able to effectively administer. So what that means is that if we didn't get vaccine for a day, if our vaccine delivery got delayed for a day, wherever it got delayed, probably would not be able to do vaccines. But let's say that doesn't happen. I'm looking at my chart of number of vaccines allotted by vaccine type. So 16,300. We had a week where we got 29,850. What I would tell you is the impact on first doses right now is that difference. So, because I think you're going to push me on this, so I'm going to give you a number. So if we could go back to that week, that was the week of January 30th, and we had those approximately 13,000 more doses, we would give 13,000 more immunizations this week. And they would be first immunizations because we are protecting our seconds.
Okay. I think I have it. Yeah. So subtract 16.
That's what I would do. Yeah, because we know, first off, we know we can do that 29,850, right? We've done it. Mm-hmm. And now we have 16,300. I would tell you that we could do a lot more than that difference, which is about 13,500. We could do a lot more than that. And I hearken you guys back to some of, what we did in Green Valley. We did 1,000 vaccines a day for 3 days in a row. We could do that again without any problem. So because we have the infrastructure, but we don't have the vaccine.
Okay, and from your perspective, would you say this is a severe cut?
I would say it's a concerning cut, and to be frank, what's most concerning is we can't predict the future. So just like everyone in their individual lives, things happen and you accommodate it. At some point, the impact will be greater because it will have a ripple effect.
Okay. All right. Thank you.
Okay. Thank you, Patty. Next up is Christopher Conover, followed by Bud Foster.
Hi again, Dr. Cullen. I guess I'm trying to tie a number of things you've said together, if you will. Taking the cuts, for example, using simple math because we're journalists, if you do a 10% cut, do you determine, or the county determine that's it? Every provider just gets 10% fewer, and how do you make that determination, especially with the equity question for places like Ajo and Arivaca?
Yeah, Christopher, this is a great question, and I wish my immunization coordinator was on because we could share with you how we lament our Thursdays in terms of how to do this. So I'll harken back to the tier that we developed. So what happened to this? So let me be frank about what happened this week, okay? We know we can do accelerated assisted livings. We chose to maintain at the level we were at. That's 200 shots a week, not very much. We had canceled our mobile clinic. Remember, this is tier 2, the disadvantaged, the vulnerable population. We had canceled that for this Saturday when we got our allotment last week. Remember, there's always this 8 to 9 days behind. We elected to say, no, we're not canceling it. We're doing this. This is really important. That's 500 shots. The shots are a little funky because it depends on Moderna and Pfizer and how much you can get, but let's use the 500. Then we looked at our second shots and we said, we anguished over this. We decided we can't cancel second shots, especially in the group that's getting these second shots, because people were really concerned. We were, it's already been difficult for some of our seniors to get in. So we're like, oh, we can't confuse people more. So we did that. So what you see is this impact on the first shots. And to be frank, one of our facilities was not fully booked yet. And we said, we recommended that they don't book, because we were worried we weren't worried. We wouldn't have been able to give them enough vaccination. So, and I'm pretty sure this is in Mr. Huckleberry's memo. I'll pick on TCC because they're awesome. They can do 1,500 shots a day. They can probably do 2,000 shots a day. They are just cranking there. Their allotment for this week gives them up to maximum 1,050 shots a week. So if you did that math, and I preserve second shots, there's 450 shots a day that are not being given just at that one site.
Okay, thank you.
All right, from Buzz to Bud. Bud Foster, you're up.
All right, and I agree with you about TCC. I had my first dose at TCC on Wednesday, and it just was a perfectly run operation. Right. It was really good. The state also, I want to talk to something near and dear to your heart. The state also talked about the underserved population today and how they have been underserved. But they said also that the Johnson & Johnson vaccine, when it arrives, should help alleviate that situation a lot for two reasons. First of all, it's more doses. But secondly, because it's only one dose. And so they will only have to go to those communities one time. And it'll make it much easier for them. Is this something that you have thought about, you have considered, and you have talked about that you will do, and it will ease that situation as well once Johnson & Johnson comes online?
But this is a great question, and I will tell you, we brought it to our ethics committee. We have a very active ethics committee. The impact, the value of Johnson & Johnson is it is only one shot. But there's concern about its effectiveness. So we had Dr. Carlos Perez, who's our infectious disease person. We knighted him and said, you try to figure this out, because the last thing we want to do is be perceived that a vulnerable population is not getting a shot that is as efficacious as the other shots, right? I mean, that smacks of things that have happened historically in the United States. So we actually brought this to our ethics committee with the data from an infectious disease person that did a very academic review of it. And we did decide that there are probably situations where this vaccine may be easier to administer because you don't have to do a second shot. But yet at the same time, the last thing you want to do is say, this one vaccine only goes to this one community. So I don't anticipate that we will do that. I anticipate that Johnson & Johnson will look to many places like the Moderna and the Pfizer look now. So some places do one, some places do two. And so we will have this, in a sense, a shared distributed model of who gets what vaccine. The caveat to that is Pfizer. Pfizer is very difficult because of the cold chain. Moderna's difficult, but not as difficult with the cold chain. J&J appears to be even easier with the cold chain. So the caveat to that is if we can maintain a cold chain appropriately. Thanks.
All right, we only have about a minute left, so Eric Fink, make it quick.
Okay, so I want to go back for a moment to this, which is we know that the U of A state-run pod is expected to open on Thursday. Dr. Chris said earlier in the week that the allocation is going to have to come out of Pima County, but now I'm hearing that it's possible that they have saved some doses to allot to the UA that's not out of your allotment for next week. But my question is this: with the fewest number of doses coming in, Dr. Cullen, next week, 16,300 in about a month, is it wise to be moving to a state-run pod given the fact that the vaccine supply seems to be extremely limited right
now? Yeah, we're worried about that. I would caveat one thing, Eric, just from Dr. Chris' blog, the 2,000 doses of Moderna that went to the university, my read of that at least had been that they were originally slated for Pima County. So they would have come into our allotment, and they were directly allotted to the university. You know, long term, we have had a wonderful relationship with the university. We always knew we needed a high efficiency, high throughput pod. We need the university pod to be successful for all of us, to meet those numbers that we've been talking about of immunization by June. So we have to work together. I think the concern right now is, given the resource constraints that exist, is now the right time to make that decision. Obviously, the state thinks it is.
Thank you.
All right. Thank you, all. That will conclude our time today. Do appreciate your all patience with the moving start time, and we'll see you on Tuesday.
Thanks, everybody. Have a great weekend.
Thank
You too. Thanks so much.